My client came in with shoulder pain in her right shoulder and neck area, and I am going to show you how to receive and give a good massage and what techniques to use while doing or receiving this type of work for the shoulder. So I believe that levator scapula and rhomboids and trapezius are usually the muscles that we need to focus on for the shoulder pain. Rotator cuff, depending on what the client is repetitively doing on a daily basis, is most likely going to be necessary as well. Right now, this is the levator scapula, the attachment site for the levator scapula. And this muscle moves at both the neck and the shoulder. Not all muscles do that. It's a rarity. This is something that only happens with a couple muscles in the body. So this muscle is moving all the time if you are using any type of arm movement, shoulder movement, or neck movement. People usually reach back and work on themselves right on the insertion point or attachment point of this muscle. It's the one they go to. All clients have discomfort in their levator scapula. I've been doing this for 18 years and not one client has ever come in without complaining about this area. So I'm basically just trying to find the center of the muscle to reset the nerve, to reset the muscle spindle cell. And in order to do that, the client needs to be relaxed and be breathing. So are you doing that? Yes. Okay. So when I get to an area that is tender, I just want to make sure that you can take a deep breath in. If you can't, then that's an indication that the pressure is too much, okay? So, right there. Is that tender?
Yeah.
Okay.
It's good.
It's good, tolerable?
Yeah.
Okay. So right now I'm on the, near the superior angle of the scapula where the muscle inserts, and that's on the shoulder blade area. And it's tight, as usual, on most people. If you do any type of office work, anything that's going to bring your shoulder into a forward rotation, then this is going to be a muscle that you're going to want worked on. Now I'm focusing on the area where the levator scapula comes in contact with the supraspinatus, which is right on top of the shoulder blade area, on the scapula, on the spine, above the spine of the scapula. So supraspinous fossa, to be exact, is the origin of this muscle, and the insertion is over here on the shoulder, on the bicipital groove of the shoulder. So this type of work is needed if anybody has chronic discomfort or any type of obvious pain that they're experiencing on a regular basis, from whether it's from work or stress at home or both. It's going to be an area that needs to get work done, I think, with everybody. And now I'm moving down toward the center of the mid-back. So like that's the rhomboid area in the lamina groove of the spine. So between the vertebrae, there's a lamina groove that has deeper spine muscles, and that is an area that I usually use a little bit more pressure in for, you know, obvious reasons. It's going to be an area that the client is usually tense in but doesn't know until getting worked there. Trapezius, mid-trapezius, rhomboids, and the transverse spinalis group, multifidus rotatoris, and then there's spinalis, which is one of the erector spinae muscles. All, I think 6. I'm working on about 6 different muscles, and that's not even including the neck. And there's a lot of neck muscles that travel through this area of the spine as well. Show a different angle. So that it can be seen what type of pressure I'm using, where I'm working, what muscle I'm working on. This right here is, again, near the medial border of the scapula, which includes rhomboids, trapezius, levator scapula is up a little higher. There's some neck muscles here, splenius capitis, splenius cervicis, though. So many muscles that run through here that get kind of stuck together that always need attention and massage and circulatory type of work. And then when you receive massage, you know, from your massage therapist, you need to ask them to be as precise as possible, getting into the muscle attachments. Not to tell them what to do or anything, but it is very important to work on the muscle attachments, which are the tendons of the muscle. The tendons and the ligaments play a huge role in getting muscles to come back to optimal health. They need to be moving, they need circulation, just like every other system in our body. Is that tender?
Mm-hmm.
Do you feel it anywhere else other than your shoulder and in your neck where I'm at?
No.
Okay. If a client feels the discomfort traveling anywhere other than the spot that is getting massaged, usually it's indication of nerve inflammation or entrapment, especially in the brachial plexus where the nerve travels through the armpit area, through the shoulder, through the pec muscles, through the neck, anterior neck muscles. So kind of gives you a clue on where and what muscles are causing that referral. This is levator scapula where I'm at now. Grasping onto it, getting that circulation into the belly of the muscle. You don't have to, you know, use a lot of pressure. Not necessary. A lot of massage therapists don't know that. You don't have to use a lot of pressure. It's really easy to kind of grasp onto it and move it in kind of a soft, relaxing motion. I believe that mind and body are so very connected, and if you don't have relaxation in both while you're receiving a massage, then the massage isn't going to be as effective. There are other aspects involved, like nutrition and water intake, but if the client is completely stressed out in their mind, how is the body going to heal? How is the body going to relax? So I believe that working therapeutically and holistically, keeping that in mind, keeping that energy in mind, being very clear with the client in breath work and relaxation while they're receiving massage is important. Wow, okay, so there is some tension here in the rotator cuff area on top of this muscle, and I'll adjust the view. Yeah. So infraspinatus is one of the trouble areas that when somebody is using their shoulder a lot for a living, or not stretching, not working out as often as they would like, this area gets really tight and short and chronically enables, or your muscle itself is not getting the right amount of blood flow and oxygen. So it really gets unhappy. It's a very sensitive area to get worked on for most people, especially the area around the lateral portion of the scapula. So I'm trying to get to the center of the muscle, which is located on the actual scapula, on top of the scapula. And the center of the muscle is where the nerve runs through, where the trigger points usually reside, commonly right through there. Is that tender?
Yeah.
Yeah. And what's that feel like? Do you have a word that comes to mind?
It's sharp.
Sharp. Okay. Yeah. Trigger point.
That one goes down.
That one goes down your arm.
Mm-hmm.
Is it the back of your arm or the front of your arm?
It's the back.
The back.
Mm-hmm.
Okay, so that to me says that possibly triceps, the triceps muscle is involved, because they both these muscles kind of insert at the same area on the humerus, on the head of the humerus. So it's possible that triceps is sort of stuck to infraspinatus or the rotator cuff in some of its fibers. So we would go with that information that we got from the client to receiving, or to separating the fibers between the rotator cuff and the triceps tendons up in the deltoid or upper arm area. You never want to poke the client. You never want to feel poked as a client. You want this process to be relaxing and enjoyable. So anytime you're on the table and you receive this kind of deep tissue massage or therapeutic massage and you're uncomfortable the whole time, then you're not receiving it right. It needs to be nurturing. It needs to be calming in order to be therapeutic.